Now coming to the ulnar nerve. Ulnar nerve root value is the ventral rami of C8T1 along with C7 joint. So from the median nerve, lateral root of the median nerve. So C7 C8T1. Now it is known as the Mauritian nerve. Okay, it lies medially to whole superior extremity. In the axilla, it is between the axillary artery and the axillary vein. As the axillary artery name changes into the brachial artery, so it lies medial to the brachial artery in the arm, and in the proximal part, it pierces the medial intermuscular septum. So it pierces the medial intermuscular septum proximally, and it turns back to the medial epicondyle. So it is palpable. It is palpable in the medial epicondyle of the humerus. Medial epicondyle of the humerus, it is palpable. Okay, so it is palpable, and so there is a tingling sensation, and so humerus is known as the funny bone. It is not a content of the cubital fossa. It is not at all a content of the cubital fossa. So it comes to the forearm, it lies with the axillary artery, and it lies between the flexor carpi, two heads of the flexor carpi ulnaris. Between two head of the pronator teres there was median nerve. Between two head of the flexor carpi ulnaris there is ulnar nerve. So ulnar nerve will supply in the lower two-third. It will be with the ulnar artery of the forearm. Lower two-third of the forearm, it will accompany with the ulnar artery. Now it will supply two nerve, two muscles. What are the two muscles? The flexor carpi ulnaris, because it is in between the two head of the flexor carpi ulnaris. So it will supply to the flexor carpi ulnaris, and it will supply to the medial half of the flexor digitorum profundus. Lateral half of the flexor digitorum profundus is supplied by the median nerve. So medial half will supply to the by the ulnar nerve. Now two cutaneous branch. So what are the cutaneous branch it will supply? The dorsal cutaneous branch of the dorsum of the hand, medial half of the dorsal of the hand. So medial half of dorsum of hand is supplied by the cutaneous branch. Okay, it is a cutaneous branch, and then it accompanies with the ulnar artery up to the lower two-third of the forearm. So lower two-third of the forearm, it will accompany with the ulnar artery. Then it will supply one branch to the it will supply to one branch to the palmaris brevis. So this is the palmaris brevis. So this is the palmaris brevis. So it will supply one branch to the palmaris brevis, and it lies medially and beneath the flexor retinaculum. So it lies beneath the flexor retinaculum, and it will be divided into superficial and deep. Superficial will supply the medial one half of the digit, the cutaneous supply. The cutaneous supply to medial one half of the digit in the dorsal side. So in the dorsal side, the cutaneous supply of the lateral three and a half is supplied by median nerve. Medial 1.5 digit is supplied by cutaneous supply by, that is touch pain sensation, by the median nerve, the ulnar nerve. And the superficial muscle will also supply the hypothenuse muscles. So what are the hypothenuse muscles? The hypothenuse muscles. So this is the hypothenuse muscles. So what are the hypothenuse muscles? The thinner muscles were supplied by median nerve. Okay, now the hypothenuse muscle, that is abductor digiti minimi, flexor digiti minimi, and opponens digiti minimi. So all the hypothenuse muscles are supplied by the superficial branch of the ulnar nerve, and the deep branch will supply the adductor pollicis, the medial two lumbricals, because the lateral first and second lumbricals are supplied by the median nerve. So other two lumbricals are supplied by the ulnar nerve. The medial two are supplied by the ulnar nerve, and 4 to 1 dorsal interossei and the palmar interossei. So these are deep muscles, right? So that is why the deep part of the ulnar nerve in the hand, in the palm, will supply these muscles. So deep will supply the 4 to 1 dorsal interossei, 4 to 1 palmar interossei, adductor pollicis, and the medial two lumbricals. The lateral two lumbricals are supplied, that is the first and second lumbricals are supplied by the median nerve, but the next two are supplied by the ulnar nerve. And the cutaneous is the cutaneous supply by the superficialis, that is the superficial part of the ulnar nerve, medial one half of the digit, and all the hypothenuse muscles by the superficial ulnar nerve. So this is all about the ulnar nerve.